Hey guys, so I know I promised I would give you an update about my first lymphatic drainage massage. I am currently 17 days post-op from my mommy makeover surgery, and I went for the first time today, and I have to tell you it was an amazing experience. I didn't really know what to expect. So a few things, obviously if you've just had a mommy makeover surgery, you're probably still wearing all of your compression garments. So a full faja or stage 1 compression garment, as well as your tight sports bra. So one thing that you want to keep in mind is that you're gonna have to give yourself extra time to get undressed and dressed again, because obviously putting those things on and off takes time, and in my case, I don't know about you guys, but like it takes a 2-person effort, especially because I recently sized down to a small garment. So I know I usually get like my husband's help to pull the garment on either side to get those clasps in and to do the zippers. So just make sure you find a therapist that you're really comfortable with, who will even like help you with things like that, because I know I needed my therapist's help for unclipping the side of my faja before I could get out of it, and then at the end I needed her help to sort of do me back up all the way. One thing I did do, and it was great that I did it, was I brought a pair of underwear, because as you'll know, you don't usually wear underwear for a while after your surgery because you are wearing the compression garment binder. And so that usually sort of takes care of that. You're usually wearing like your compression garment. If you want, you could put underwear over top of that, but that just seems very restricting to me. And then you could put pants over top. But anyhow, I'm not really wearing underwear right now, so I packed a pair of underwear to wear just during the massage, and that was really helpful that I had brought that. So I'm not able and not allowed to lie flat on my stomach, and my areas of concern going into my massage was I just wanted to do like some work on my back, because my back still feels very, very sore from the liposuction. Like it feels like almost like it's bruised to touch all over. So I wanted her to work on my back to help with that, you know, circulation, and to promote some healing from the bruising from the liposuction on my back, and to hopefully also help me stand up straighter in time. I wanted her to work on my head, because my head has been very sore in the back since the day of my surgery. I don't know if it's from like being 8 hours in surgery with my hair in a ponytail and being flat on a bed. Maybe my hair elastic sort of dug in, or maybe it's from like being in a bed in an upright position all night sleeping and in chairs. So I just felt like a lot of bruising on the back of my head. So I wanted her to do a bit of head work, and then I wanted her to work on my chest, because lately I've been getting a lot more sensations in the breasts, and I want to promote healing there, and I want the implant to eventually drop in fluff. And sometimes I get a little bit of inflammation and pain, I want to say, in my armpit area, and this week especially on my left side. So I have to say, like, she was absolutely amazing. So in terms of the positions that you can go in after surgery to receive your massage, she had me sit in a chair on the end of the massage bed and basically had a pillow on the massage bed. So I sort of like hunched forward like this with a pillow, and she did my back that way. So I was sitting in a chair, leaning forward onto the massage table, and she sort of worked on me from behind, and it felt so nice to have someone touching my back, and it wasn't sore at all while she massaged it. So that was really good. She was able to see like my liposuction little holes, I guess you'll say, that they went through from, and those are healed now. Like they scabbed and healed over actually really quickly, and the scabs even fallen off of those. So she kind of just gently massaged my back, which was really, really nice. And then for my head, she did a really nice head massage. Once again, head and neck, just sort of getting things flowing there. That was really, really nice. And then for my chest, she did a really amazing job. So she did, she actually had 2 like smaller face cloths, and she covered my breasts with the face cloths just to give me a little bit of privacy, although I could care less if she saw my breasts, but she did do that because she needed more access to my breasts than I guess typically with a massage. And she did really good work on the top of my breasts, underneath, and promoting drainage and flow out towards the armpit area. And then she did up down my arms. So as she was massaging me, I just felt like very invigorated, and I felt like my blood circulation and flow was really, really good. And I also just felt like I could feel like almost like same like I described in the past, like almost like milk dropping when I was a breastfeeding mom. Like I just felt like milk dropping feeling from my neck and chest area. So overall, my first lymphatic drainage massage experience was very, very positive. I wasn't sure if maybe after my massage I'd be super tired or sore or maybe very swollen, but actually I felt like euphoric after my massage. I felt absolutely amazing. I did go home after that. I put my binders on, like as soon as I left the massage, she helped me put everything back on, and I did go home and like rest a little bit. Like I put my feet up and I just sort of sat in bed for a little while. I ate a good lunch. I've been drinking lots and lots of water, and honestly, like it was a very good experience, very positive. Nothing was painful. Reassuring my massage therapist that I felt great and that nothing was hurting me, I think was helpful to her, because obviously after having a mommy makeover, you're pretty botched up all over, so people might be afraid that perhaps maybe they're hurting you, but I assured her that nothing hurt me, that actually it felt really, really good, and I'm really looking forward to seeing sort of the results that I get from that massage, even if it was just for that relief that I got for that hour while I was in it, and maybe over the course of this next week, maybe I'll feel less swollen, maybe I'll find that things sort of settle in a bit better, and so yeah, I just wanted to give you an update. So lymphatic drainage massages, absolutely worthwhile if you have benefits like through your workplace like I do. Those would be completely covered by your benefits in most cases, and it's very good timing for me because it's the beginning of the year and I have my full benefits for this entire year at my disposal. So I'm planning to basically use most of my healthcare benefits for massage over this next couple of months as I'm healing and to promote that healing process. So I'll be out of them by mid-year or the end of the year, but that's okay because I think this is all very important right now for my recovery. I find here in Canada, like they don't speak as much about lymphatic massages and like the importance of them. Like you do hear about it, and my surgeon's office, Dr. Kara's office, did speak to it in my post-op instruction booklet. Like they did mention lymphatic massages and that they recommend them and that they're fine to do. But in the States, like in the US, the other bloggers I follow, like they talk about it a lot more, and some girls, like even the day after surgery, are already going for their massages. So I think it's really important that here in Canada we also discuss the importance of these massages, even if it is just for the instant relief. My massage therapist didn't do any like manual extractions of liquid. I have heard that there are certain lymphatic drainage massage therapists who physically extract liquid from certain areas, you know, just through pressure and through the incision spot, and I know there's a lot of controversy over that and if that's safe to do and appropriate to do. I just want to clarify, I did not do that type of massage. If to me it felt like a gentle relaxation massage, but very specific flow in terms of the directions that she went in and what the target areas were, and her pressure was a lot less than what I'm used to when I go to her for like regular therapy and even a regular relaxation massage. So I felt really, really comfortable with my massage therapist and what she did. So I just wanted to give you guys an update about that. So 17 days post-op lymphatic drainage massage, highly, highly recommend, and I can let you know in my next video whether or not I saw any concrete results from it. Thanks, guys.